So in Tesco's now, you can get all different types of tests. You get a strep test, you can do your own UTI test, you can do HIV testing, you can do FOB rapid test for faeces, you can do FSH rapid test midstream, you can also do an allergy test. How cool is that? You can also get an iron deficiency test.
Over-the-counter tests are even available in supermarkets now, but how reliable are they? Sadly, with the state of waiting times for most doctors, wherever you are in the world, many of us feel the need to get answers quickly. So these tests could be tempting. These tests could be helpful, but some of them also give me, a gynecology doctor, some cause for concern. So the UTI test, first of all. Well, you might pick up a UTI test if you're feeling those classic symptoms like burning when you pass urine, frequency, or discomfort when you wee. The urine test that we see in that video tests for nitrites and white blood cells in your urine. Those are markers that could suggest that you have an infection, but here's the catch. They could miss infections. They could give you false negatives, or they could flag something that isn't actually a UTI, so they could give you false positives. The problem is that there are lots of things that can give you symptoms like pain when you're passing urine, and it's not always an infection. It's so important that we're checking the urine also for other things like blood, because that can actually be a rarer marker of someone who could be developing cancer. So that's why I prefer a full urine dipstick test if someone's got symptoms like this. And that's what we use at the GP practice, at hospitals, and they're better than these over-the-counter tests. So even if the test does show a positive, it also doesn't tell you which bacteria is causing your symptoms. And so you can't really give that effective treatment without doing tests again. So I would suggest it's always best to discuss your symptoms with the doctor before self-diagnosing, unless they have specifically advised you that you could use those at-home tests. For example, you get recurrent UTIs. So next up, the iron deficiency test. Well, if you're feeling constantly tired, weak, or even dizzy, you might be tempted to pick up an iron deficiency test because it could seem like a quick solution to take some iron. These tests measure something called ferritin. It's a marker of your body's iron stores. However, ferritin levels actually do respond to inflammation in your body. So you could get a false result if your body is fighting an infection or you've got another inflammatory condition. Plus, iron deficiency anemia is about more than just ferritin. So you do need a full blood test to check if you're actually anemic, not just having low iron levels. So looking for your hemoglobin and other markers to give you a complete picture. If you're feeling really tired and you're not yourself, you should speak to your doctor rather than just grabbing one of these tests. So finally, the FSH test. So an FSH test might appeal to you if you're curious about your fertility, or if you think you could be approaching the menopause and you want to know. Follicle stimulating hormone, FSH, is important because it's part of our ovarian function tests. And a very high level of FSH could suggest that someone could be going into the menopause. But these at-home tests only give you a single snapshot. FSH levels actually vary naturally. They fluctuate throughout your cycle. And so one result, which might not be at the right time in your cycle, can't give you a full picture. A thorough hormone panel from your doctor, which would include FSH as well as LH and estrogen, is much more reliable and gives context to what's happening in your body. Another thing to bear in mind is that finger prick blood tests aren't collected in the same way as the standard lab blood tests. The reliability isn't always up to the same standard. They don't go through all those extensive checks and balances that those lab tests do. So these over-the-counter tests might be the future, but at the moment they're definitely not a substitute for seeing your doctor, especially because understanding the results and what happens next would usually need more of a discussion. So yes, I would save your money. Have you come across these and were you tempted?